it's not every day I stand up and say that the majority leader has spoken for me. But this is one of those days, and I've always suspected that the majority leader is a good man, because whenever we come to critical junctures where we have to close ranks and say if something is working, it's working, if it's not working, it's not working, he has always done so. And that is the conversation we've been praying for in this country. Honorable Speaker, and Madam CS, you're present here. The President, I heard him yesterday saying he pays 50,000 Kenya shillings for SHA. I very painfully pay an average of 32,000 Kenya shillings every month to SHA. And I say painfully because Majority Leader, you will recall that when that bill was here, I proposed an amendment to cap that contribution at 5,000. Unfortunately, that time, when a Majority Leader, you are not as good as you are this morning. You allowed the... you voted to defeat that amendment, Honorable Speaker. But I want to cut through the noise, because here in Nairobi, they say, hatutaki mambo ya kizungu mingi. Now that the President told us that if we remove that capping, that if all of us pay according to our abilities, we will end the specter of harambes to raise money for healthcare in this country. Can the Cabinet Secretary standing here before the Senate today confirm to us that there is no family in this country that has planned a harambe for this weekend to get payment for a loved one to obtain health care, including that baby Ariana, Honorable Speaker? Can she confirm that to the country? And if she cannot confirm, then she should be gentle enough, she should be kind enough to tell us today that this thing is not working, that we should go back to the wisdom of SIFUNA when we were having this conversation in this House. Regarding the challenges facing the SHA rollout of the new Social Health Insurance Fund. Honorable Speaker, you can see that despite the fact that the Cabinet Secretary for Health was here in the morning, questions continue to abound. And Honorable Speaker, while she was here, after I had made my comments, and you know the rules of this House don't allow us to speak twice on the same issue, my phone was inundated by messages from this Universal Health UHC workers. Because as you know, Honorable Speaker, after the Gen Z movement, my number is now a public number. It was disseminated to just about everyone in the country. Honorable Speaker, out of the more than 500 messages that I got, I distilled the three issues from what those UHC workers were telling me. And these are matters that I think the committee now has to have a very intimate session, both with the leadership of the ministry and even these UHC workers themselves, Honorable Speaker, so that we get to the bottom of these matters. Number one, it is the opinion of these UHC workers that the Cabinet Secretary for Health, Deborah, might have misled this House on the question of whether all UHC workers have actually been put on permanent and pensionable basis. That in fact, Honorable Speaker, she only, or the ministry only confirmed the people working, or the UHC workers at the national hospitals, and that in fact 8,572 of those UHC workers are still on contract for the last 5 years. This is a matter that the committee must get to the bottom of and report to this House. Number two, Honorable Speaker, it emerged that UHC nurses have been on strike for 3 weeks, Honorable Speaker, demanding to be put on similar terms to their colleagues who are working in these national institutions. And Honorable Speaker, they are saying that the ones who are not put on PNP, although they do the same work, in fact they face the same workload, they are being paid up to a quarter of what their colleagues are earning because of the status. Honorable Speaker, they also told me that they have not been paid gratuity since the days of Corona in 2020. These are the messages that I received on my phone. And I'm hoping, Honorable Speaker, that when the committee sits down to deal with these questions from Senator Hamida and Senator Mundigi, that they will deal with this issue. Lastly, Honorable Speaker, I could also discern from those messages that the UHC workers are saying that there was a supplementary budget that was passed in the National Assembly for absorption of UHC workers. They just want to know, where did that money go? And unfortunately for me, Honorable Speaker, I had already spoken and I didn't get opportunity to ask that question directly to the CS. But now that this matter has come up again and it is being committed to the Committee of Health, I would want to encourage the Committee of Health led by Senator Mandako. Let him invite these UHC workers in the same room as the Cabinet Secretary, because, Honorable Speaker, The only way to get to the bottom of the truth when there is blame game, and they're also saying they're tired of the blame game between the government of Kenya, the ministry, and all other players. Can we have all these people in one room with the minister and let them get to the bottom of these issues? I thank you, Honorable Speaker.